I'm honored to be presenting this study on behalf of all my collaborators and co-authors. So as we heard at the previous talk, that TNM staging is suboptimal for predicting prognosis in patients. And the prime reason for this is that it is based on a qualitative assessment of T descriptors. And the previous body of work has shown that CT-derived tumor volume can be used to stratify survival in patients with epithelial mesothelioma. The current study was undertaken to establish the feasibility of using tumor volume as a T category, and also to assess inter-observer variability and the distribution of differences between readers when assessing tumor volume. This is a multi-center study and with preoperative CT scans in DICOM format, including demographic and clinical and pathological data, which was submitted to CRAB by the participating institutions. The DICOM data was then made available to radiologists for a blind and independent volumetric analysis and clinical staging of these cases, which was submitted then back to CRAB. Volumetric assessment was performed using Vitria workstations by all the radiologists. A training set and online training preceded the final assessment. Correlation between readers was performed using the Spearman rank correlation method. A PowerPoint slide was created using the methodology and was circulated among all the readers. 5 cases were selected for a training session, and then a webinar was arranged, and all the radiologists went through a training session prior to scoring these cases. This is an organizational chart of the study. As you can see, there were 6 institutions which contributed data for the study, which included CT scans, clinical and pathological and staging data. The CRAB then sent these CT scans to AG MedNet, which de-identified all identifiers from these scans, and then sent these scans to the 3 radiologists to assess the volumetrics on these cases and also do a TNM staging on these patients, which was blind and independent readings. The volumetric analysis and then the clinical TNM staging on these cases was then sent back to CRAB, and now CRAB is finally analyzing the database. So I'm going to be presenting some of the results as the analysis is still ongoing. 6 institutions contributed 153 subjects with complete clinical and pathological data to CRAB for analysis. Out of this, 141 subjects were deemed eligible with adequate quality CT scans for volumetric analysis. Of the eligible and adequate quality cases, 130 cases have been assessed by both readers, and of these, 128 had pathological T category available for comparison. Reviewer A tended to assign volumes larger than those assigned by Reviewer B. The variability between reviewers was quite large, only for a few cases, but the overall correlation was very good. Approximately 67% concordance was seen between the 2 reviewers measured in the context of the 4 volume categories. Here is a paired volume distribution of reader A with normalized reader B, of reader B with normalized reader A readings. As you can see that the distribution of the volumes was very similar between the 2 readers. A scatter plot showing the Spearman correlation between the 2 readers, showing a very good correlation. Sorry. Here's a breakdown by concordance per stage, and you can see there was approximately 67% concordance per stage. A histogram analysis showing the paired differences between the volumes per reader, and we saw that 40% of the volumes were within 60, plus minus 60 cc's. 3D volume rendered images showing volume distributions per stage classifiers, and as expected, the volumes, as the stage goes up, the volumes per stage classifier also ends up being larger. As expected, the differences between the readers with increasing stage tended to be tended to increase as well. So in conclusion, volumetric assessment of mesothelioma is feasible at research level. Good correlation was seen between 2 independent radiologists with regards to volumetric CT analysis. Translation to clinical practice may need improvement in quantitative assessment of mesothelioma and overcoming some of the technological limitations. Ongoing data analysis and detailed review of the results and multidisciplinary discussions will help plan a larger prospective international study. And finally, I would like to acknowledge and thank all our collaborators and contributors to the study, and MARF for funding the study. Thank you.